Hi, this is Dr. Gabriel Lerman. I am the Director of Osteopathic Education here at MCMC. I first want to thank you for thinking about us when looking into locations for your internal medicine residency. We do not take that responsibility lightly, and we are very serious about your education. In addition, we believe that osteopathic medicine is good medicine, and as a result, have a robust osteopathic education program here at MCMC. A little bit about the leadership in osteopathic education. I myself am a graduate of the MCMC Internal Medicine Residency Program. From there, I did a fellowship in critical care medicine and returned as one of the intensivists, and recently took up the helm of Director of Osteopathic Medicine a few years ago. Karina Sundstrom is our interim internal medicine program coordinator, and Margie Carroll is a program coordinator for the transitional year residency. We have a long and proud history of educating osteopathic physicians. For the last 40 years, we have been training both allopathic and osteopathic doctors in two separate but equal internal medicine residency programs. In 2016, we obtained our osteopathic recognition and merged both programs into one. Your osteopathic education here at MCMC will be significant and robust. You'll have the opportunity to incorporate not only osteopathic manipulative medicine and techniques, but also the osteopathic principles of mind, body, and spirit, and the whole patient approach. You will have all the requirements necessary to obtain your osteopathic physician's license anywhere in the United States. Our osteopathic residents even continue to apply osteopathic principles both in the inpatient and outpatient settings. We are one of the primary teaching locations for the Philadelphia College of Osteopathic Medicine. As a result, you'll have plenty of opportunity to mentor and teach our medical students. However, it is not just local medical students that come to us. We have had students from as far west as Pacific Northwest School of Osteopathic Medicine and as far north as University of New England in Saco, Maine. Our mission statement is the foundation for which we build our education program on. We provide an environment where osteopathic residents enhance patient care by providing adjuvant osteopathic manipulation to patients both in the inpatient and outpatient setting. An education program where osteopathic residents have the chance to further their knowledge on the use of OMT in all disease conditions. We want to give our osteopathic residents the chance to conduct research in osteopathic techniques for the betterment of patient care. And we want to provide osteopathic medical students a clinical environment for which they can apply the skills that they learned in the classroom. We have a very robust osteopathic curriculum that meets all of the ACG-ME requirements for osteopathic recognition. We have osteopathic conferences once a month, and this is protected time, and during your first year when you present fulfills your osteopathic scholarly requirement. Osteopathic manipulative medicine online video series. Annual osteopathic in-service examination, which is also required by the ACGME, teaching of osteopathic medical students, and a biannual review of your osteopathic techniques with the Director of Osteopathic Education. Building on the foundation of osteopathic techniques that you learned in medical school, we then take it from there. We have our osteopathic case conference, which is a monthly occurrence, and this is protected time. We then review some techniques, learn some new techniques, and we then apply it to real-world situations, both in the inpatient and outpatient environments. We also discuss appropriate documentation, billing, and coding to get you ready for private practice or practice within the hospital setting. It is not all lecture. We break out into groups and we practice the techniques throughout the entire conference. During that time, you will also have the opportunity to teach medical students as well. In the next slide, you will see an example of one of our residents conducting such a conference.
One of the really important important parts about this is that you really need to stabilize the shoulder joint as you're doing this. And so I'm going to make sure that I keep my hand up here and keep his shoulder stabilized. And I'm going to take him into extension until I feel the barrier. And if I'm doing the articulatory technique, I'm just going to pulsate here. And I can feel him kind of starting to go a little bit more into his range of motion, into his barrier and past it, increasing his freedom.
We have purchased a site license for ommeducation.com. This is an online series that you do at your own pace in order to enhance and facilitate your continued knowledge on osteopathic manipulative techniques. To ensure that we fulfill all of the ACGME requirements, especially for formative evaluations, we do participate in the Cortex examination, which is a self-paced 75-question exam specifically on osteopathic manipulation. As mentioned before, we have a lot of medical students come to us for their rotations. You will have plenty of opportunity to not only mentor, but also teach these future physicians and future colleagues. We get students from all over the country, including locally from the Philadelphia College of Osteopathic Medicine, since we are one of the primary teaching hospitals for them, as well as right across the river at Rowan University. But we also get students from West Virginia, from LECOM, not only in Pennsylvania, but also Florida. We've also had students from University of New England, as well as Pacific Northwest. The ACGME requires a biannual review of your osteopathic skills, and twice a year you will undergo a skills evaluation as well as a formative review. We do this to ensure that you get all the credit that you have earned to obtain your medical license wherever you wind up practicing. So, what have our graduates done? Well, we are proud to say that over the last 10 years, we have had a 100% pass rate on the American Board of Osteopathic Internal Medicine boards exam. Our graduates go on into fellowship, independent practice, and hospitalists. Our DOs have the opportunity to become chief residents of this program, and since 2012, there have been 4 DOs as chief residents. And in fact, in 2012, both chief residents were DOs. Our DOs are well taught, and they have the opportunity to do whatever it is that they want. Our DOs have gone on into fellowships in critical care medicine, pulmonary critical care medicine, pulmonology, cardiology, nephrology, and endocrinology, to name a few. I am one of those graduates who did critical care medicine. Another one of our graduates, Dr. Josh Pregnar, is also critical care medicine, is the director of the medical ICU at Nazareth Hospital. Thank you so much for the opportunity to tell you more about our program. And I look forward to meeting you in the future. And if you have any further questions, please feel free to let us know. Thank you and good luck.